everyone, this is Marika and welcome back to another session of Communication and Education Technology. In our previous sessions, we have discussed about what is community, what are the elements of community, what is community health, and what is a community health nurse, and what is community health nursing. We also discussed about health and its concept and various dimensions of health, wherein we have seen that there are different dimensions of health, which includes physical dimension, spiritual dimension, emotional dimension, intellectual dimension, environmental dimension, and occupational dimension. We've also seen various aspects that are included in these different dimensions. In this session today, we are going to discuss about health promotion. As we hear the term health promotion, we can understand what is health promotion. Now, before we go on and discuss about health promotion directly, let us understand where did this concept of health promotion started from. Every health or medical profession has taught some of the human behavior which contributes to the negative as well as the positive aspect of health, which means health and medical profession believe that the behavior of an individual influences the health of an individual. It influences the good health of an individual as well as the illness of an individual. There can be some behavior in an individual which can be the basis for developing an illness, for acquiring an illness. There can be some behavior of an individual which actually serves as developing the illness in the individual. In simple terms, we can say that some behavior of an individual, some behavior that is done by an individual causes harm to the health of an individual, and because of those harm are the risk factor that leads to development of the illness eventually. Now, that is the negative aspect of an individual's behavior. There is, of course, another aspect where certain behaviors of an individual which will help the individual to improve their health or protect or promote their health. So we have two different kind of behavior. Of course, every individual will have some kind of negative and positive behavior. Now we are talking negative and positive in terms of health of an individual. So those behavior that can serve as a risk for developing the illness or for having an illness are considered as a negative behavior, and those behavior which serves as a positive behavior which will help them to promote their health are considered as positive behavior of an individual. When we think about a proper balanced diet, exercise, proper rest, proper sleep, all of these factors come into positive behavior which will help to prevent the illness, or we can also say that it will also help for promotion of the health of an individual. When an individual adapts to all this healthy lifestyle, or when the individual adapts to all the positive behaviors such as diet, physical exercises, following a proper exercise, good rest, adequate sleep, all of this will contribute for maintaining an optimum health of an individual. As human beings, as we are biological animals, we need proper amount of rest, we need proper amount of nutrition for our body, for our organs to function. So those factors obviously will contribute to keeping us healthy, and it will help in health promotion as well. Now, when we think about diseases, especially communicable diseases has one causative factor, but we also see that the transmission of the disease from one individual to another individual are vastly reduced by various other factors such as proper water supply, proper sanitation, ventilation, housing condition, etc. That was about communicable diseases. When we think about chronic diseases such as cardiovascular problem, cancer, or diabetes also, it is not an acute illness to occur over a short period of time. So it takes time for an individual to develop that illness or for that illness to consume an individual. But in the starting, when the disease is starting, or in the very early stage of the diseases, it does not directly affect the individual. It does not affect the quality of life of an individual. It is over a period of time it affects. And why does it affect over a period of time? Because the individual, even after suffering from certain illness, certain chronic illness, they are not careful about their health behavior. Now, they are not careful about the lifestyle they are supposed to follow. They are not careful about the exercises they are supposed to do. They may not even maintain a proper rest and sleep cycle, and they may not even take adequate nutrition as demanded by their body according to their disease condition. So in communicable disease, as we know, it is caused by one single agent, but there are various factors that influence influences the disease, prevention of the disease, as well as transmission of the disease. And when we take about a chronic disorder like a cardiovascular problem, diabetes mellitus, also in the very early stage, it does not affect the individual, it does not affect the quality of life of an individual. But then over a period of time, when healthy lifestyles are not followed by an individual, when an individual is not able to maintain a good health behavior, then the diseases will start causing problem to the individual, and it can sometimes even be fatal. Chronic diseases also may have several factors that are associated, like communicable diseases. Even though the cause can be one, it can have a multiple cause. There are various factors that influence the disease and the progress of the disease in a human body, and a proper healthy good lifestyle can help to reduce the effect of the disease to a large extent. Now, communicable diseases, even though there's one causative factor, or various other chronic illnesses which has multiple factors, can affect an individual, it can affect the health of an individual, and of course it causes problem in the individual. But we have seen there are factors that are associated with the transmission of the disease or with the lifestyle of an individual that will help to reduce the disease of an individual. But when we think about problems such as poverty, drug and alcohol abuse, physical violence or homelessness, all of this cannot be eliminated with even health promotion. So in communicable disease and in chronic illness, we've seen that various ways of improving the health behavior of an individual helped in having or maintaining a proper life to the individual to some extent. But for problems such as poverty, alcohol and drug abuse, physical violence, or homelessness cannot be prevented through health promotion, which means health promotion is meaningless when the basic needs of an individual is not fulfilled. The basic need of people such as food or housing, when it is not provided to the individual, when the individual do not have their physiological needs covered, then health promotion is meaningless. As a community health nurse, as we are studying community health nursing, the community health nurse must understand the cause of the problems in the community. For the promotion of health in the community, the major role is played by a community health nurse, and she is the one who is responsible for the health of an individual within the community. She is responsible for the health of the community. So what can a community health nurse do? She must be aware about what is causing the problem in the community, what is the actual cause of the problem. She must be responsible for the factors that are causing ill health in a given community. As a community health nurse, our responsibilities are not just finding out what are the health needs and giving solution to the health problems or giving health education to people. We are supposed to analyze the psychological, social, and environmental influences on each and every individual. So various psychological, social, environmental factors are to be assessed and analyzed by a community health nurse so that she can plan a holistic and individualized care for the particular patient, for the particular community. So as we know, every individual is different. We have individual differences, and within a community, we as a community health nurse may be exposed to many different people even in the same family. As a nurse, we must not only see the health problems that are actually visible to us, but also try to analyze the psychological, social, and environmental factors that are affecting the health of an individual and community. As a nurse, a community health nurse must also take up the responsibility to health educate the people of the community. It is our responsibility to make sure people are aware about how a disease is transmitted. People are aware about the communicable diseases that are present in the community, how it can be prevented, what can be done in order to stop the transmission of disease from one individual to another. And as I said, not just about prevention of the disease and not just about treating the people who are sick, but as a community health nurse, we must also be able to teach patients about healthy lifestyles that they can adapt, so that they can adapt to those healthy practices and ideas to maintain their life, to prevent themselves, to protect themselves from any kind of illness. So a community health nurse has the potential, has that power to make sure that she uses the educational strategies in the right way to convey messages to people at the right time, what is required according to the need of the people and educate the people about various changes and for promotion of health and prevention of illness. Now, basically, when we think about health promotion, what is health promotion? Health promotion is a science that is actually aiming to reach the optimum health. Reaching optimum health is health promotion. So health promotion is not just about falling sick, treating the people, or helping people to revert back to their pre-disease functioning, but it is about helping the people to understand about the lifestyle changes that they can bring in order to promote their health, in order to make sure that they practice healthy lifestyle, that they adapt new changes which will protect them from illness and also reach the optimum health. So any activity that is aiming at the well-being of an individual, well-being of the community, prevention of the diseases and health hazards, or control of the diseases comes under health promotion. So health promotion is what? Health promotion is a way, any activity that we conduct, any activity as a community health nurse that we carry out in order to make sure that the people are protected from the disease. There is prevention of the disease, there's promotion of health, or which aims, any activity that aims at the overall well-being of an individual, which help them to reach their optimum health, is health promotion. Health promotion is again and again, as I'm telling, not about falling sick and then treating the people and helping them to regain their pre-disease functioning. It is about helping people regardless of their health status to make sure that they adopt healthy lifestyles so that they prevent themselves from falling sick or protect themselves from any kind of diseases. If we take the present world and analyze, right now we can see that people, individual healthcare professionals are focused on improving the quality of life and not following the traditional method of just controlling the disease when the disease occurs, or prevention of the disease when it has already reached to an extent where it becomes uncontrollable. So presently, if we take the world today, we see that the world today focuses on quality of life regardless of our health status right now. Let us see the definition of health promotion. Health promotion is considered as a primary prevention and is directed towards modifying the human behavior to adopt positive and healthy lifestyle. So as I said, health promotion means any kind of activities that are carried out that aims at the optimum well-being of an individual comes under health promotion. It can be prevention of the disease, it can be health education for creating awareness, it can be helping the people to adapt to new changes that will help them to maintain their life, it can be ways through which people can cope up to the new illness that has been found, new pandemic that has been found. Any activity that aims at optimum well-being of an individual is considered as health promotion. So this definition also says that it is a primary prevention and it focuses mainly on modifying those behavior of an individual which has a negative impact on their health and helping people to adopt healthy and positive health behaviors. In simple terms, what is health promotion? Health promotion means making use of those strategies, making use of those techniques which will help an individual to improve their overall health status. So any activity that is carried out by individual, any activity that is carried out by a community in order to maintain the optimum health of an individual is health promotion. So health promotion is about helping people adopt those lifestyle, helping people modify those negative behaviors in them which will help to promote the health of an individual. Empowering people with proper amount of knowledge, correct knowledge and education will help them to live a socially as well as economically healthy life. So education is one of the important component which will empower the people, which will help the people to live a healthy life socially as well as financially. Therefore, health promotion plays a major role in maintaining the health of an individual. So to educate the people in order to make sure that they bring those changes in their lives to help them promote their health, to help them live a healthy lifestyle, all of these activities fall under health promotion. So in order to make sure that people follow those proper habits, we need to educate the people. Therefore, health promotion plays a major role in providing good health in the well-being of an individual as well as in the community. According to World Health Organization, Health promotion is defined in the simplest form possible, and they say that health promotion is the process of enabling people to increase the control over their health and to improve their health. So this is one of the simplest definition of health promotion, which says that health promotion is a process of enabling the people to increase the control over their health as well as to improve their health. So any activity that is carried out, any task that we carry out as an individual, as a healthcare professional, as a community, which actually aims at the well-being of an individual, which actually enables the individual to have a proper control over their health as well as improve their health, comes under health promotion. As we have been discussing about health promotion, one very important thing that we have to understand is that it is not just about the responsibilities of healthcare professionals. It is not just about medical professionals. It extends beyond that. It goes to each and every individual as well as each and every community. So people should understand that their health is in their own hands and they are the one who should have control over their health, and they are the ones who are supposed to adapt or bring those modifications that will have a positive impact on their health. I hope you've understood clearly what health promotion is now. The only aim of health education is to improve the health of an individual physically, mentally, socially, and spiritually. So there's only one aim for health promotion. We are promoting the health of an individual. We are helping the individual promote their own health, to have a control on their own health, to improve their health, only to make sure that there is a complete well-being of an individual, not just physically, not just absence of any diseases, but it is also about mental, social, and spiritual well-being. So the functioning of an individual, that is physical, mental, social, and spiritual functioning of an individual, must be improved, and the main aim of health education is to make sure that it is achieved. Let us now move on and see what are the prerequisites of health education. There are majorly three prerequisites of health education, which includes educate, enable, and mediate. So let us see in detail what is educate, what is enable, and what is mediate. The first one that we have is education. Now again, from the term itself, it is very clear what is education. Now what is education in terms of health promotion? Then let us see. Now education, when we think about general education as well, and when we think about health education as well, these are two different aspects but have the same goal. So when we think about education in general, when an individual is educated, it will help the individual to become aware about what is happening. It will make the individual aware about what is to be done, what not to do, what is a healthy lifestyle and what is not a healthy lifestyle. What to do and what not to do is clear to individual who's educated. And when we think about health education also, health education is purely aimed at, is about providing awareness to the people, communicating health related matters to people, bringing those changes in the life of the people, bringing those changes, helping the people bring those changes in their behavior, which contributes to health promotion. So once a person is educated regarding a topic, or once a person is an educated person in general, it will help the individual to understand, to have the awareness about things and bring necessary changes in their health behavior, in their behavior which is causing harm or which has a negative impact on their behaviors. Now, once someone is aware about the merits and demerits of a certain behavior, it is obvious that people will try to avoid if it has a negative impact, and if it has a positive impact, people will try to repeat those behavior. So if people are aware about the dangerous effect or negative effect with proper education, if people are aware, then people will not be following that behavior. People will not be repeating that behavior because they are aware that the behavior that they are doing is contributing negatively. It is having a negative impact on their behavior. So education is one of the major prerequisites of health promotion. Educating the people, bringing the awareness in the people, and having educated people in the community will majorly help in health promotion. Education is one of the way of empowering people, which will also help people to adopt necessary positive behavioral changes. And we have the second one, which is enable. I am an educated person. I have enough information. I know what are the things that are causing negative impact on my health. Now, what is the next step to do? I should have a good control over the negative behavior, and I should be able to implement the positive behavior in my day-to-day life. So, enabling means individual need to have control over the negative behavior, which can have a negative impact on their health. They should be able to also adapt to the necessary changes and make sure that those changes help them in health promotion. So the first thing is about getting education. Once I have a proper education, I know that what I am doing, certain behavior that I am doing is causing harm to my health, or it is very bad for my health. So what am I supposed to do next? I am supposed to control those habits and also bring the necessary changes, adapt the positive behavior into my life. So that is enabling oneself or enabling the people in the community to make sure that they are able to control the unhealthy behavior and practice healthy behavior. And the last prerequisite is mediate. Now, what does the term mediate means here? Now, within a society or within a community, there can be various different health practices that prevails in a particular community or a society. Now, these different interests related to health must be mediated by healthcare professionals, must be mediated by community health nurse to come to a solution or to compromise for health promotion. Now, what does the term mediate means? Mediate here means talking to two separate groups or talking to different group of people who have a disagreement on a single topic. For example, if I think that apple is good for health, there can be another group of people who think that apple is not good for health. So now in mediate, what are we going to do? We are going to take these two groups and have a discussion on the topic that we have a disagreement on. And why is this done? It is done in order to make sure that both of this group come to a solution that is acceptable for both of the groups. So here, as healthcare professionals, we are supposed to mediate between different individuals, and as I said, different communities, different individuals may have different kind of health practices that may be contributing negatively to the health of an individual, to the health of a community. And as healthcare professionals, we must mediate those kind of problems, and we must make sure that people understand the negative impact of those health practices and come to a certain conclusion and then come to a particular agreement. To summarize, today we have discussed a very interesting topic, that is health promotion. Under health promotion, we have only covered a very short topic, that is what is health promotion, what is the aim of health promotion, and what is the prerequisites of health promotion. I hope the class was helpful, and I'll see you all in the next session where we will discuss the remaining aspect of health promotion. Thank you and have a great day ahead.